Welcome to part 2 of Autism Moms Roundtable on the BioNexus Health podcast with Dr. Jodie Dashore, who holds a Ph.D. in Integrative Medicine, is board certified in Integrative Pediatrics, an internationally recognized pioneering clinician, and author. And now here's your host of BioNexus Health podcast, Dr. Jodie Dashore.
Hey, do you live around here so I can make an appointment with you?
Where are you from? You're from Somalia?
Yeah.
Okay, you can do a virtual consultation if you are in the WhatsApp group with all the other people here, right? You can get more information. Otherwise, it is BioNexusHealth.com and you can send a new patient appointment request.
Okay.
Okay.
Right.
Now
Thank you so much.
Oh, you're very welcome. Now there was, I see a message from Yasmin. So Yasmin, I just gave the information out about the BioNexus website, right? So it is, I'm going to type in the chat for Yasmin, www.bionexushealth.com. Right. So once you go to the website, you can fill out the new patient form. Everything is online. You don't have to travel all the way to visit me. Right. Everything is online. All the testing and all the medicines will be shipped right to your home. So you don't even have to leave your home.
Oh, okay. That's nice. Yeah, he has appointment with his developmental doctor on Monday. I want her to ask questions since I'm new to this, but I don't know where to start.
Yeah. All of these improvements that you heard from the other parents, they have all been treating virtually. It's online, it's completely virtual. There's no inconvenience to you for travel. So everything is sent home to you.
Okay. Thank you so much.
You're welcome, Rueda. Anyone else has a question? We have lots of people now, right? We have 27 people that have joined us. And well, awesome. So no one else has any questions?
I would like if you can repeat the things that you were pronouncing with the feeding therapy.
Sure. Yes, I will put it in the chat, okay?
Okay, thank you very much.
It is, of course, it is Beckman's oral motor therapy.
Okay, thank you. So are they gonna do, or is it something that we can get and use it? Because my son has that issue too, because of the Lyme issue. I think he has, problem of, a strong muscle in his mouth because he don't hardly chew some of the foods. He only chews like when the food is kind of, like a chipsy or apple
crunchy.
Crunchy thing. But he don't like to chew when it is kind of, softish food.
Yes,
it's so
I
hard for him
understand.
to do that. He's improving right now with that side, but still we have challenge. He likes to swallow right away.
Yes. Okay. Well, is it because you're making delicious food and he's inhaling it?
No, because before, remember, we have the issue of the tonsillis. He has a, swelling tonsillis, and it was so hard for him to chew, or whenever they touch, it was kind of gagging and wanna, throw up. So it was easy for him to swallow. And I used to make the food like, very soft, so it's not gonna bother him. Otherwise, he's not able to eat anything. Then later on, he improve, and his tonsils shrink. Even we visit last time November his ENT doctor, because before was so tight, there was no place, and he even recommended to remove. And he said, what do you do? I said, I didn't do anything, but because whatever you tell them, they're not gonna take it, that. Right. And he said, right now he has a clear throat, his tonsils shrink, they go back normal, but still he got used to it, the habit.
Yeah.
Because he used to have a open mouth breathing all the time. I asked him, is he breathing normally right now? He said, yes, completely. Everything looks perfect, but his tongue got used to it being out.
Correct.
So
correct.
I am working with orthodontist doctor to put maybe something so his tongue can go back. Because
right. Okay, I see. An ALF device, maybe. Correct.
Yes. The shape of the mouth got used to it. Of the swelling right here affected his mouth.
Okay, I understand. So first of all, great news, that with only with the herbal protocol, the tonsils shrunk, because as you know, for PANDAS kids, one of the things that is recommended, just like that, go for surgery. And that is one thing that is so hard for our children, is anything that is invasive, right? Needles and what have you. So I'm glad, you waited, and that, in fact, I don't remember when we had our last follow-up, Marianne, but I wasn't aware that his tonsils also shrunk. Awesome. I'm really happy. You made my day. Okay. So, doing Beckman's oral motor at home, I would recommend take at least 2 to 3 sessions from a trained therapist, and then you can do at home, because right, because it usually involves a series of exercises which just need to be repeated. So you can do that at home as well.
Yeah.
Right? So that is because I don't know, most of you probably know that one of my specialties is that I'm also a doctor of OT, and I am neurosensory integration certified. I'm also Beckman's oral motor certified, listening program, right? Tomatis, that as well. So if there is any sensory questions, any listening program questions, oral motor questions, I'm happy to help. I'm hoping to make a book. Not make a book, I'm hoping to write a book and make a podcast series which helps parents tell their therapists that, with mold and Lyme, these areas of the brain are affected, and these activities are the best to do, because it costs a lot of money. So if you're going for therapies, while you're waiting for appointment or while, doing something else, it is best to have like focus therapy. So that's
thank you very much. Really, we need that, because for a long time we have a sensory issue. We have all kind of issue, holding his ears, spinning, all that kind of thing, muscle weakness. And we need that, we need that. Yeah, probably next time when I talk to you, I'm going to talk to you about that more and see what I can do and what you can help with me. But I can tell you, and everybody knows, the product is working, but we need to be patient and strength and, take a time. It's going to take a time. Before our experience, I did many things. And when you did something, after a couple of months or a couple of weeks, whatever he gained was going back. Whatever he gained was going back. But right now it's going slowly, but it's staying there. He's understanding, he's focused. Sometimes you think, oh my God, he's doing amazing. And, flare comes in, hyperactivity coming back. But before, when that thing came, everything will disappear. But right now it's staying. Whatever flare or whatever hyperactivity he got, his knowledge is there. His voice is there. But you have to deal with it. You have to be patient and move forward. Even last month, November, we had Corona, and he was the best kid in the house. He has a tolerance. He resisted. He has 2 days fever. Then after that, he moved, forward, and everybody else got really, really sick, especially me.
Well, I'm glad you're all feeling better. And you know what? I'm even happier to hear that your son got fever. That is
he had a very high fever.
Excellent.
For 2 days. He woke up and he was like firing up, and right away we go to the bathroom and I give him a shower so he can cool down. Then later on in the morning he feels so better and normal and very active, but it was good.
Good, good. I'm glad. I actually remember, I always talk about Brian, right? I actually remember, when he was in second grade, his school nurse called me and she said, Dr. Dashore, Brian has a very high fever. You should come pick him up. So I asked her, Mrs. B, he has a fever? How high? She goes like, oh my gosh, it's 103. And I actually said, that's awesome. On the phone, and she's like, what? I'm like, you know what, I'm going to come there and I'll explain to you. So then I kind of, she was nice, she was older, right? So she was of the old school, so she was patient. So she said, oh, okay, so this is the first time he's getting a high fever in many years. I'm like, yes. So it means that the immune system is getting better. So that's why. So okay, I'm happy about that. And yes, it is important and it is possible to customize all your therapies, not so much ABA, right? Because that is more data driven, but you're actually science driven. I shouldn't say science because that's science too. What I mean is, neurologically driven therapies like sensory, oral motor, etc., communication, because if we customize according to the child's labs and genetics, remember, we also look at individual genetics. So if we look at that, it is entirely possible to customize all the therapies to what is going on with the child. Yes, so we will discuss this at the next appointment. Yeah, please remind me, Marianne. Now let's see.
Yeah, I will write it down my notes so I don't forget that. And that's really what we need, calmness and a little bit of working with his, sensory issue. And, thank you very much. Yeah.
You're welcome.
Before we didn't have all these answers, I've been looking for many places. God bless you and the lady who recommended me to go to you, because my son, I never know that he has a PANDAS. I didn't know that he has a Lyme issue. I didn't know what, mold is. And I've been dealing with biomedical doctors, even inside the state or out of the state, but nobody mentioned that. They've been taking tests, and I never met that, but thank you. And thanks all the mothers who encourage me, who are my, my backbone, like, Ilhan, Sophia, all of you. Thank you very much. I really appreciate it.
Of course. Yes, Ilhan, Safia, they are, superstars. They're so awesome. All of you are, all of you work so hard. I mean, I'm an autism mom myself, and I think, it's a big blessing to be able to help so many other mothers become super moms. I love it. So let's see, I'm going to answer some questions, right? Khadija has a question, but first I'm going to look at the messages that came in. Someone from the UK, can you make, yes. And tests and medications are easily shipped to the UK, to Europe, to Africa, Asia, anywhere you live, okay? So your question is UK, yes. We can do a virtual consultation and everything will come home to you. No worries. Then there's a question from Mahim. Is there any cause of getting a runny nose? Well, there are many causes, right? You can start all the way from food sensitivities, allergies, all the way to MARCoNS, which is infections in the deep sinus cavities, which comes from living in a water damaged environment, right? So mycotoxins will encourage the growth of MARCoNS. The MARCoNS grow deep so they can hide from the immune system. And the MARCoNS toxins cross the blood-brain barrier and it causes damage, as well as damage and inflammation in your sinus cavities. So it is important to have a look at all of those considerations, Mahim. Right, 12 years old, okay. Well, yes, I mean, 12 years old, sometimes people think that's a little bit older, but there's no such thing. You can, in fact, I had recently had a 14-year-old, like not a recent new patient, but, recently he's become neurotypical almost. Remember, no one gets to 100% Brian is not 100%. He's 95% on most days, right? Which is okay with me, because everyone tells you that autism has no cure. So at least, we are at the level, because many of you know that my son now, he is more than 18 years old. He is in medical school. He wants to become a pediatric immunologist, so he can deal with, children with autism. He can help children with autism and with PANDAS, mold, but he's been through it. Remember, he was, Brian's left leg was paralyzed. He was in a wheelchair, so much pain, so much PANDAS symptoms, and then mold exposure. So he knows what it's like. So hopefully in the next few years, once he's out of med school, he'll be my right-hand man, so to speak. But yeah, Mahim, please look into all of that. Then there is one more message. Do you do PANS test? Yes, of course. All of the underlying infections and toxins have to be looked at, including genetics, right? There are a couple different genetics, depending on what part of the world you're in. That kind of genetic testing can be done. Now, absolutely nothing invasive is required. After all of the things that we had to go through, the ultimate conclusion, as many of you have heard, Marianne, you actually heard Dika, Mustafa hasn't spoken, but Mustafa's child has had lots of good improvements as well. Ikran as well has had lots of improvements with both her girls, but completely non-invasive, no needles required, nothing invasive is required. And I think, it is the best to have a completely natural plant-based approach for your child. But again, it's your decision. That's the decision I came to. What do you think? Why do you think high temperature is good? And how do we treat? Okay, I don't know who this is, but someone asked this question. I think I kind of explained why high temperature is good. It means that is a good, strong, robust immune system response. Okay, and the job of a high fever, one of the moms, I think it was Marianne, she said that, for 2 days there was high fever, and all she did was a cooling down bath, proper fluids, resting, a lot of love, keeping the child happy, because a high fever will actually handle many of the infections. Say if the high fever is from a cough or a cold or a flu, it is not advisable to immediately give ibuprofen. If it is COVID, always consult your pediatrician, okay? Because COVID, local pediatricians, depending on what country you're in, there are established protocols for treating COVID. For kids who are on the full herbal BioNexus protocol, as you heard, COVID hasn't been a problem. I mean, I have hundreds of, if not thousands of patients around the world. Let's see, we are in like 73 countries now. And families who are doing BioNexus herbals haven't had any serious issues with COVID. Quite the opposite. And again, it's been a real blessing, including my own family. Yes, Marianne, you had something to say? No? Okay. So how do we treat if the fever gets too high? Well, yes, of course. I mean, if it is going over 103, 104 for more than a day, again, if it's COVID, consult your pediatrician. If the child is uncomfortable, you can always give ibuprofen. Okay. Khadija has a question. Yes, Khadija, go ahead.
Okay. Hi, doctor. I'm back.
Yeah.
So here's my question. My son is a mouth breather, and he's always congested. I know we are not done with all the testing. And my younger son has had tonsils and adenoid problem, adenoids were time 3, tonsils were, they said time 4 until they remove it, because he wasn't sleeping at all. So I was just, I don't know what I'm asking here, but is there a treatment for the mouth breathing?
Is there a treatment?
Mouth,
okay, yes. Is there a treatment for the mouth breathing? All right. Treatment, it all depends at what stage of adenoid issues you've consulted for a plant-based herbal protocol, right? Because as you heard and experience has been that plant-based treatment options are quite effective, but if there is underlying MARCONs, then it will affect the entire ear, nose, and throat region. Sometimes even below that, the heart, the gut, the lungs, the heart, and the gut. It can be affected by what's going on in the ear, nose, and throat region. So that's why in the beginning, even things like sleep apnea are possible if you are living in a water damaged environment, right? If there's been any kind of mycotoxin exposure. So it is important to rule all of that out. And oftentimes you will see a lot of improvement once the underlying cause is treated. So if you would like me to send you a nasal swab testing just for your younger son as a courtesy, please message through the website, and I'm happy to prescribe that as a courtesy.
And I should say, I'm sorry, what? A courtesy swab test, a nasal swab test.
Nasal
right?
swab test, correct.
Swab test. Because I wish I knew about all this before removing his tonsils and adenoid. But it's my young son, not the one that you see, not the one with autism.
Oh, I was telling you about this 14-year-old before I think I got distracted. Yes, 14-year-old with autism, moderate. What happened was, so we started treating, right? He's from Italy. And we started treating Santino from Italy it took about 14 months. Oh, that's interesting. Yeah, that's how I remember, 14 years old. And it took 14 months to see phenomena. I mean, we saw improvements throughout, as Mom mentioned, but, a real conclusive change. So little by little, language improved, gut improved, constipation went away, sleep improved. But this poor child, he was given 4 psychiatric medicines, 4, just so that he could, quote unquote, behave in school, in class. We were able to get him off all 4 psychiatric medications because, unfortunately, in some parts of the world, psych meds are the only options that they give you if your child is diagnosed autistic. So, but yes, so it is not a matter of age. I even have a 35-year-old with autism, severe autism, and she moved from severe to moderate, and we are still working, right? She's 35 years old from California. Her mom is 62, and she takes care of her, and she was like thrilled to see improvements with the gut, with the sleep, with the aggression. I mean, poor Rachel, she was 35, but she's seeing improvements as well. So, no one claims to have a cure for autism, but definitely recovering or uprooting some of the symptoms, it becomes very important. I see that Rueda has a question again. Yes, Rueda. Rueda?
I have a question, doctor.
Who's that? Dika. Yes, Dika.
So that touches me. You say like you have a 35-year autistic. My son is 17, and I always ask myself, like, do he ever speak? I have a big issue about speak. So do you ever see like older kids who speak later?
With speech at 17?
Yes.
Yes. That will be up to his neurological system, okay? Mm-hmm. Because once again, it will depend on what kind of toxins and infections and underlying triggers and exposures he's had. Remember, it is all very individual and very customized. It's not fair to put everybody, okay, he's autistic. No. It's important to kind of look at every child as a unique. So yeah, so Dika. So I think Ikran wants to join. Wonderful. Right. So is it possible to see speech? My answer would be one never knows. Okay, because there is definitely research studies have shown that anywhere from 1 to 7 areas in the gray matter and white matter are damaged. Okay, with everything that we are speaking about right now. Then there is autoimmunity to the basal ganglia brain. So it will all depend on the child. And to what extent? Oh, hold on.
Because like what wonders me is like my son, he understands both English and Somali. Like sometimes he understands my normal kids, they don't understand that much Somali, but my son understands really good Somali.
Okay, so he's understanding. So he understands Somalian and English. That's wonderful. So he's a smart kid, right? So
but no worries. There is no worries. That's what like I get surprised. He now a lot. His brain is working very well. Like maybe a couple months ago, if I like go my sister's house, like if I'm going that, he know the road is her. Like if he needs something, he know the store that we used to live like 3-4 years ago, and we moved on. But there's nowhere it's coming up.
Oh, okay, I see. Yeah, I wish I had met him many years ago. But if you're asking me if there is room for improvement, yes. I don't know if language will come back. I don't know what symptoms will come back for any child until we look at the underlying issues.
Okay.
All right, now let's see. Ruweda has a question, right? Ruweda, go ahead, please.
Hello? Can you hear me?
Yes, Ruweda.
Yes, I fixed my my camera right now.
Okay. Hello.
I have a question about the tonsils and unnoised. My son, they say that his tonsils are really big. They need to remove it, and his eye noise are big too. They need to remove it. But he said first he will remove the nose one, and then later on, when he grow up, they will remove his tonsils. And I told them I don't need it right now. Because the reason why we went to ETN was always his mouth was open.
Yeah.
During the night, he snores, but he doesn't have that much issue. What else? Like he doesn't have other stuff. Only that. His ABA therapy. She said to me, she told me, and we went to the doctor, and they see him. He really seems like he's okay, but I don't want to go to again and make him sleep and do that procedure.
Yes.
I don't want it because I did one time sleep for his teeth. He had what's it called, cavities. They had to fix. Yeah, they had to fix all his teeth and take off. It was like 3 hours sleep. So I don't want him go back to sleep again and remove all that. I said I need to wait. They give him nasal spray. We use that every night. It's okay. But do you recommend them to be removed, or what do you recommend them?
Well, I cannot recommend surgery for someone who is not a patient. And pretty much I never usually recommend something like something major like surgery until I see all the reports and we wait and see how the child is making progress, right? But you said, the ENT doctor told you that the issues are not severe, So which is good news. Yeah. So which means, you know, that you have some time to try alternatives and to try and see if there is any other infections which we need to look at, right? Which by which we can help your child. Yes, because you know, I've been speaking about mold exposure and MARCoNS, and there's plenty of peer-reviewed research, right, medical evidence available that, you know, MARCoNS can affect not only your throat but also your teeth. Right, you know, many of our children get you know, flare-ups if there is any kind of dental problem. Right, even for basic cleaning, when they go, you know, they get flare-ups. That's because all of the underlying infections or microbial imbalances has not been addressed. So, you know, that's pretty much what Marianne was talking about.
Yes, Marianne and I, we really have the same issue. Her son and I, my son.
Okay.
When she was talking, I thought she was saying about something about my son. I was like, how does she know that?
Yeah. Yes. So
my son, he understands me. Yeah, he understands me very well. If I call him, hey, Mohammed, come here, you know, say his name. He understands both Somali and English. And he really, sometimes when you call his name, he will look at you back. And sometimes he will not.
Okay.
And he likes to be all by himself and do all the things by himself all the time.
Okay.
So that's the only issue. The speaking, I feel like there's his memory or his brain. There's nothing wrong. Just because if you teach him or take him someplace.
Yes.
The next day he remembers. He when we go that place again, he doesn't forget. He remembers what is that place.
Yes.
So yeah, the tonsils and that, I don't want to like make a decision right away and do it. But he give me chance. He said it's not something really like right now. It has to be done. But he said in the future I recommend you to do it.
Okay, yes. So now there is multi-system inflammation in the body when there are the underlying issues that you know, we have been speaking about. Hey, honey, look at the cutie pie there. Hi, sweetheart. Hey, you're so cute. Okay, so it is important to release that inflammation and to release any infections to, you know, treat any of the underlying issues. And often even with adults who've been exposed to mycotoxins and who are doing the CPAP machine and what have you, I've seen tremendous improvements after the underlying problems, you know, because there's a big difference in just treating the symptoms. Okay, there's a symptom, so you have to treat, you know, but what is causing that symptom is the main thing to look at. So what is causing that open mouth breathing? What is causing the adenoids and the tonsils to be inflamed? That's what you should look at. Always look for underlying causes. Okay.
Oh, okay. All right. Thank you.
You're welcome, Rueda. So now let's see. We have a Zoom user. I've just asked you to unmute. I don't have a name. So
she doesn't speak that much English, but I'll help. I don't know either, but I will help her. Bisharo, min maklusa.
Ha, makluya ruedo. Maxaa ii weydiisaa? Cunugayga wuxuu jiraa 20 iyo 2 sano jiraa, iska dhe 2 sano jiraa. Cuntada markii la cuno wuu fiican yahay, sidoo kale caafimaad ahaantiisu wuu fiican yahay, laakiin cuntada markuu like waxaan shiidnayn oo shiid ahayn ma cunaayo. Haddii wax la ruugo sida wuxuu jecel yahay apple-ka iyo canabka, markuu ruugo calaanjiyo waa soo tufaa. Hadduu dhuunta u galo isla markaas hore soo matagaa.
Okay. Hi. Hello, can you hear us?
Yes, I can hear you. What's her name?
Her name is Bisharo.
Bisharo. Hi, Bisharo.
Hi.
Okay, go ahead.
She said she has a 2-year-old son. They have issue with eating. He will eat only solid, liquid food. Like when you blend food, he will eat it. He will not eat a solid food.
Okay.
He will eat, let's say, the apple. He will chew that, and he will after he wants to swallow, but he cannot swallow. He will like throw it in the ground, you know.
Okay.
So for him, it's kind of hard to swallow. If he swallows a little thing, he will throw up. So, and he's not afraid. He will try every other food, except instead of swallowing the food, he will like throw it on the ground, the food. So she wants to know, they want to eat the nose and throat specialist. They took x-ray, all that. They say that there's nothing wrong with him. Just he needs like a feeding therapy.
He needs feeding therapy, they told him, right?
Yeah.
Okay. So, Bisharo, I would recommend that you listen to the full podcast, okay? Because it's being recorded and it will be released on YouTube in sections. We'll do like, you know, part 1, part 2, because it's very long. So I spoke about feeding problems, low muscle tone, being an issue with PANDAS and underlying Lyme. So if your child may just have that, so you need to make sure that you are finding out, right, you know, testing for PANDAS, as well as all the triggers for PANDAS, along with, you know, Lyme disease can also be one of the triggers, and co-infections, remember that. So if there is low muscle tone, if there is any kind of neurological issues with the swallowing, it's important to find out what's going on. You know, if you go to ENT specialist, I think you said you did, and he has not found any blockage, that's good news.
Yeah.
So it means there is inflammation, and there may very well also be an infection. So it's important to rule that out, okay?
All right, thank you.
Thank
You're
you.
welcome. You're welcome, Bisharo. All right, Asmahan, any
Yes.
questions? Yes.
I'm sorry, I had a problem with my microphone, but I think it's working now.
Good.
I have 5.5 years old child. They told me he has autism and ADHD.
Okay.
But they told me his autism, it's what's it called? They have 1, 2, 3. I live in Sweden. So they said his autism is not that much, a lot, but because he's hyperactive and his concentration, you know, is very low.
Okay.
And he has some problem with, what's it called? When he plays with the kids, you know, he will beat them. He has some social interaction problem. So, but they didn't do any other test. It was just the, what's it called? The normal diagnosis, which will sit with the psychologist and the doctor. But which type of test or blood test or anything do I do before I start any kind of treatment? Because he's hyperactive, you know?
Yes.
6 in the morning till what's it called, 7 in the evening. It's not easy for him to sit down and to listen, you know? And sometimes he has meltdown like 3 to 4 times a day.
Okay, so it is, you're in Sweden, it is, so see if you can test for, obviously, right, you have to look for underlying issues. This whole discussion today is to try and understand that, you know, many children with autism can have underlying PANDAS, biotoxin illness, mold exposure, Lyme disease, co-infections. And when these are identified, along with some genetic testing, then we can customize a plan for treating the children, and that will reduce the inflammation in the brain, in the gut. And we see a lot of improvement, just like I saw with my own child. So that's what, you know, today's discussion is about, is to make make you parents understand that there is a lot of hope. Don't ever give up hope that, oh my God, I just have an autistic child, or that I have to do surgery or invasive procedures without it being an emergency. Of course, if it's an emergency, if it's a severe issue, you always need to do what needs to be done. But if it is a chronic issue, there are alternative treatments available that are all natural. Now in Sweden, once again, we can do online treatment, not a problem. But some of the blood tests, which you can look for some of the triggers, I don't know if your pediatrician will be able to do the blood test for you, if they are open-minded. But
I will ask. I don't know. I will ask.
Right,
because,
you can ask.
yeah.
So wait, what is your Asmahan? Sorry, so let me see. Let me put this in one message. So this is not to Mahim. This should be to everyone. No, yeah, it's going to be to everyone, and this is going to be for Asmahan, but it applies to everyone. So see if you can get ASO, mycoplasma, anti-DNase B, AB, strep antibodies, mycoplasma, and then you have to look for Epstein-Barr virus, IgG and IgM. You can look for, yeah, these three are important blood tests to do. So anti-DNase B, AB, strep antibodies, mycoplasma, Epstein-Barr, ASO. It will give you important information. Okay.
Yeah, thank you. I hope
you're
that.
welcome. What was, yeah, well then here, IgG subclasses, Asmahan, this is another one, IgG subclasses will look at the state of the immune system as well, okay? So whatever is possible. And basic blood test, I'm sure she can do for you, right? Which is the complete blood count and complete metabolic panel. So all of these, I'm sure, everyone can see them in the chat. If not, open up your chat. It's in the chat. It's on the screen as well right now. So it will show up in the recording, but yeah. So this is the blood test. Now, many children with autism, cannot do blood tests because it's very difficult. So that is where what I do is all non-invasive, right? These are other different kinds of testing, including for the genetics, right? We do completely non-invasive, right? Treatment as well as testing. Okay, so I think I answered all the questions, right? Let me just make sure that I answered all the questions before. Oh, Marianne answered a question. Thanks, Marianne. That's great. So then there was a question from Annie. Annie Hussein, son was diagnosed with autism. He's 4 years old. He got diagnosed with PANDAS 5 days ago. That's awesome. That's great. I'm glad someone is aware of that. It's probably not PANDAS. If he has autism, it's probably more like PANS. PANS is, it means multiple triggers, not just strep. PANDAS just means there is strep. I'm sure there are other infections if a diagnosis of autism has been given. But anger behavior is getting bad. What advice can you give me? Well, the best advice is going to be make sure that you get it treated. Whoever gave you the diagnosis of PANDAS, right? Ask what infections that doctor is suspecting and ask the doctor to treat those infections, right? And again, remember, watch my Herxheimer reaction podcast. That is going to help you understand the die-off reaction, especially if your doctor will be using antibiotics to treat. Okay, So just be aware of that, so you're not scared when you see the die-off, because many mothers get scared when they see the die-off reaction. Okay, so that was for Annie Hussein. Now, any other questions? I think we are good, right? Yes. Good. So shall we come to an end of today's podcast? Now, all of you are welcome to let me know if you would like me to do another podcast like this, so you can share with your WhatsApp group, and I'm happy to answer questions. And I will schedule another one, but today it was, it was wonderful to meet and see everyone again. Those we've already met, it was nice to see you. And those I'm meeting for the first time, it was really nice to meet you. Especially, I mean, we are all autism moms, we are all in this together. We know what happens. We know, the emotional ups and downs that we go through, right? The anxiety, the depression, all autism moms go through. Everybody blaming us that you must have done something. I mean, geez. I don't think I did anything wrong. Just like any mom, I took the utmost care during pregnancy, after as well. But, it is just, there were so many factors that were out of my control. So it's just, so I'm glad. I was happy to have so many moms here. It's such an honor and a privilege to meet everyone.
Thank you very much, Doctor. We really, really appreciate it. And one last thing that I want to say, the new moms that are joining, they have all kind of confusion. The ladies who were there already, and Mustafa, they already there, they know what they've been through. And the new moms, what I can add is they have all kind of confusion, what to do, what not to do. Relax, take a test. You will know what's bothering your son, whether it's the hyperactivity, whether it's, anxiety, mouth breathing, all this issue, you cannot know until you do all the tests that the doctor recommended. After that, you're going to see a clear answer, because to me, before I was confused, someone will tell you something and you jump right away and no, it's gonna make it worse. Then you come back later and you're gonna do another thing and it's gonna worse. But after you do the test, every question will be answered by its order, the way it is. Oh, he has a PANDAS. What's PANDAS? Then you're gonna see the symptom. The doctor will explain and you start the treatment. You will see flare-up. You will see anxiety. You still will living in that motion, that wave through us right and left. But stay still. Stay strong. You will get the answer you're looking for. Never give up hope. She gave me the best hope that I never had, and we're feeling it. And we're not recovering yet. I'm not saying my son is 100%. Even he's not close to 50%. But I see the light. I see the shining light that tomorrow will be better than today. Every single mother, never give up hope. Thank you very much, Doctor. We really, really appreciate that.
Thank you so much, Marianne. That was very well put. I'm so glad you kind of, summarized it together. Yes, it's, never give up hope. That something, if that is the only message that we have put across today, then I think, my 2 hours today has been successful. That, don't let anyone tell us parents that it is a life sentence. That your child is autistic, that's it, it's a life sentence. And, all you can do is to just manage with psychiatric medicines, with surgery, this and that. Please investigate properly. There is a lot of information, and just like it was explained, we will be able to connect the dots. Don't just go after individual symptoms. Okay, so now there is a sleep issue, so we have to do sleep study and then give this medicine. Now there is hyperactivity, we have to give hyperactivity medicine. Please look for the big picture. Just find what is really going on and treat all of that. And, most of us, all of us have seen tremendous improvements in our children. Okay, good. I guess, Khadija, a question? Yes, go ahead.
What do you think about reversing upper lip tie?
That's a good idea. Don't expect miracles, but I've seen some changes.
Okay, because every dentist that we went to were very hesitant to do it, and they keep telling me, oh, he's 5 years old. We don't want to traumatize him.
Okay, so wait a minute, Khadija, this was upper lip tie or tongue tie?
Upper.
Okay, so upper lip, I've seen even less improvements than with a tongue tie removal, right? You know, tongue tie removal can be done by certain specialized dentists, and they do it, you know, with laser. It can be quite painful for the child because, you know, anesthesia wears off. And remember, if you are doing any kind of tie removal, there has to be proper therapy after that. You know, therapists are trained to work with children who've had tongue tie removal, for example, because, you know, otherwise it just becomes tight, right? Or it comes back.
He doesn't have under the tongue. It's upper.
No tongue tie. Okay, upper.
Yeah, no.
Right. Yeah, if it is not urgent, you know, and if someone's telling you that, you know, you won't see a whole lot of improvement, I would recommend that you wait it out. You know, the best is to just make sure that all of the underlying issues are addressed. Okay.
Okay. We'll see you soon, next month.
Oh, good. That's good. Okay.
Yes.
So I guess, you know, you've done the labs.
I'm doing the last one on Monday, so
okay.
I should be emailing on Monday.
Okay. All right, good. So I hope all the questions have been answered from today. I think we also addressed, you know, Sudi's concern as well. And I think we are good for now, right? And if you know, if anyone wants me to do another one, please let me know. Was it in the chat? Did someone say something? Good. So thank you very much, everyone, for being here. And I will see you guys next time. Bye for now.
Thank you very much. Bye-bye.
Well, that brings us to the end of today's podcast. That was very interesting. We had some very important questions that were presented. And I think all in all, a lot of good information. So I hope you found it informative as well, educational as always. And feel free to write me back if there are any additional questions that need to be addressed. I'm happy to. There is a form on the homepage of BioNexusHealth.com. So you can fill out that form regarding podcast ideas, or if you have any questions that I can address on my podcast, I'm happy to help. All of you have a great day, and I will see you back here at the next episode of Autism Uprooted. Take care now. Namaste.
That concludes Part 2 Autism Moms Roundtable on the BioNexus Health podcast. Thank you for joining Master Herbalist Dr. Jodie A. Dashore, Director of the BioNexus Health Clinic and BioNexus Herbals, on the BioNexus Health podcast. You can subscribe for free on most podcast apps. By subscribing, you encourage the algorithms to spread our messages of hope and healing. You may also leave a review on your preferred podcast app or share on your social networks to promote the podcast, where we explore and share information and stories about recovering and healing from chronic and environmental illnesses such as mold biotoxin illness, Lyme disease, autism spectrum disorder, fatigue, Crohn's and colitis, mast cell activation syndrome, PANDAS, and more. For more information, visit BioNexusHealth.com.
Information within this video, audio, or text, collectively known as the podcast, has not been reviewed by the FDA. Nothing within the podcast is intended as or should be construed as medical advice. Information is for general informational and educational purposes only. Consumers of the podcast should consult with their healthcare practitioners for medical recommendations. Seek the advice of a qualified healthcare provider. Do not disregard the advice of a healthcare provider based on any information from the podcast. The information within the podcast may contain information concerning dietary supplements or over-the-counter products that are not drugs. Our dietary supplement products are not intended for use as a means to cure, treat, prevent, diagnose, or mitigate any disease or other medical or abnormal condition.